So, we're first going to go over a brief and just broad summary of our client so everyone is informed on all the pieces. Identifying information, our client John is a 32-year-old man who is a veteran and has been honorably discharged. He does have a history of substance abuse, so just a brief history about that. John has reported drinking heavily in the past and using any drugs he's able to receive. Also reports without good support, he does not seem to be able to cut back. John's social history, he graduated high school and went to technical school where he was trained as an electrician. He was working in this before being drafted to Vietnam, where he reports having an out of the character moment. Since he has not worked but once for his uncle, he also reports feeling jealous when others are enjoying themselves to the point he wants to physically assault them.
Since John has returned from war 10 years ago, his noted symptoms are reported as follows. He has a depressed mood that he notes as most of the time. He is, as Alexus mentioned, struggling with substance abuse, mainly alcohol at this moment in his life. Prior to, there was some drugs involved, but he currently reports that drugs are not at the forefront at this time. He has suicidal thoughts and has 4 attempts in his history. He does report regarding his suicide thoughts that he is unhappy that they were not completed. He has very limited social support. He has a hard time with interpersonal relationships and intimate relationships. He struggles with insomnia, struggling to sleep at night and feeling restful in the morning. He has feelings of absent-mindedness, and he describes this as just feeling out of it, possibly due to the alcohol he is consuming. He reports a normal appetite and sex drive, and he also reports a poor memory due to potentially his alcohol usage and maybe some side effects from the war. In addition to those, he reports no delusions or hallucinations unrelated to his substance abuse. He has at times admitted jealousy issues, and these have transpired into anger outbursts. Okay. For his most likely diagnosis, we as a team evaluated him and are looking at post-traumatic stress disorder. The code is F43.10. The criteria for this disorder, prior to the criteria, the screening question asks about the worst thing that's ever happened, and if he's ever experienced or witnessed an event where he was seriously injured in his life or there was any endangerment. John does have a history of an event in Vietnam where he did kill a civilian for the quote, the fun of it. So this is his traumatic event. When further asked, do you think about the experience? He reports yes. So in regards to the criteria, the first one, intrusion of symptoms. He has the issue with memory. He feels that the memory of the event haunts him, and he has a lot of guilt associated with this. The next one, avoidance symptoms. He deals with internal reminders, which means that he works hard to avoid thoughts or feelings about this incident. As far as negative symptoms, the criteria notes that he has to have at least 2. John qualifies for most of them, as following negative self-image, negative emotional state, very decreased participation in his own life, and an inability to express positive emotions. The last one is about arousal behaviors. This looks at his irritability and aggression as noted when he gets his anger outbursts, as well as sleep disturbance, which was also mentioned. So overall, looking at the DSM-5, it appears that John is unable to enjoy activities in life, maintain his friendships, a job. His symptoms are impeding on his life in every way, from the time he wakes up in the morning to the time that he goes to bed. And his intense suicidal thoughts and ideations are a big limiting factor for him.
The first possible diagnosis is other or unknown substance use disorder. Presenting symptoms that might support the diagnosis are alteration in mood, sleep disturbance, impairment in social and occupational functioning, and the use of substances. This is most likely not the diagnosis because the symptoms can be better explained by another disorder. The second possible diagnosis is alcohol use disorder. Presenting symptoms that might support the diagnosis are conduct issues, depression, anxiety, insomnia, and frequent heavy drinking. This is most likely not the diagnosis because the symptoms can be better explained by another disorder. An increased rate of alcohol can increase anxiety and depression symptoms, therefore resulting in comorbidity. The third possible diagnosis is major depressive disorder, recurrent episode, severe with melancholic features. Presenting symptoms that might support the diagnosis are depressed mood, mostly all day, every day, diminished interest in activities, insomnia, feelings of worthlessness, suicidal ideations with multiple attempts, impairment in social and occupational functioning, and diminished ability to think or concentrate. This is most likely not the diagnosis because the symptoms can be better explained by another disorder such as PTSD. John had no reported mental issues before going to Vietnam. The event that triggered his symptoms was due to killing a civilian for the fun of it. According to the DSM 5, page 280, individuals with PTSD are 80% more likely than those without PTSD to have symptoms that meet diagnostic criteria for at least one other mental disorder, which include depressive, bipolar, anxiety, or substance use disorders. Due to John's symptoms starting after a traumatic episode, major depressive disorder would not be the main diagnosis.
Additional information that would need to be known would be the following, which falls under cognitive and emotional behaviors. And it would be, does John avoid things that trigger memories or feelings of the stressful event in question? Is he hypervigilant? And is he easily startled? Under physical information, it would be, are there any psychomotor agitation issues, such as any physical difficulties completing daily tasks? Is he fatigued? Were there any previous head injuries? And is there any significant amount of unwanted weight loss? In addition to physical information, more information on his upbringing is needed because he doesn't describe his childhood very well. So knowing how he would describe a normal childhood would need to be known, along with knowing if he witnessed or experienced any violence growing up. Additional social information that would need to be known is anything regarding his upbringing. And I'm sorry, guys, I read the same thing twice. Has he lost interest in all or most of his daily activities? Under psychiatric information, I would need to know, was he on any previous medications and for how long? What was the dosage and the strength? Were there any adverse side effects? And also, did he take any alcohol in conjunction with those medications? In addition to that information would be the strengths for his community would need to be identified along with his ethnicity.
Based on the assessment, the likely course for John's illness is a drastic decline in his mental and physical health. Without ongoing support, there is an increase for completed suicide. As mentioned in the case study, John's depression has increased over the past 10 years. He no longer finds enjoyment in activities. He has had 4 suicide attempts in the past 7 years. He has reported the desire to die if things don't get any better. His memory has become worse. John has been experiencing several bouts of alcohol withdrawal with onset of hallucinations and delusions for the past 2 months. These factors contribute to John having a significantly higher rate of suicide in comparison to someone without these factors.
Considering John's ethnicity is unknown, the only cultural consideration there is his culture, is his veteran's background. And often most veterans will only talk to those who have served. And often this is specific to the branch, the duty status, deployment location, and shared experiences. In addition to that, the available resources for Vietnam veterans and how well they are coping with reintegration into civilian life should also be taken into consideration.